We were lucky enough and timely enough to bring an international speaker to Foothills to talk about music therapy techniques in the neurological population in particular, and how basically the neuroscience of music in the brain. And the National Music Centre supporters were very interested in that same speaker, and we were able to then receive that great grant funding, large amount of grant funding, to be able to expand the program and try to collect more information showing that it is beneficial to patients. Since 2016, we had started a very small pilot project, and I've been involved since then, monitoring how people are responding to it and how patients are doing with it, and trying to find ongoing sources of funding.
We have a team of 21, which includes accredited music therapists, interns, aides, and management staff. And with that wealth of skill set and education, we're able to provide a beneficial and successful service to the community and also to the program specific to Foothills Medical Centre. Specific to the program here at Foothills, the goals range from improved mood, motivation, cognition, respiratory function, to decreased agitation, anxiety, and stress, to also assisting with pain management and the rehabilitation of motor skills and speech.
Well, first I was hesitant about what can a music program do for me, but what I've found over the last few months, of course, is the impact it does actually have. You can only watch so much TV.
Some positive changes that I have seen personally with our music therapy program is the development of patients' speech while they're singing. During their music therapy session, they often work on their range of motion when they're playing musical instruments, and generally an overall increase in a positive mood for both the patients and their families during the music therapy program.
It promotes like healing with the patient, emotionally, mentally, and physically.
So I've seen patients go from needing a fair bit of pain control to being able to reduce the amount of pain medicines that they need.
The patients that are coming to the hospital with acute neurological problems sometimes have difficulty communicating, and music can give them a way to communicate or express their emotions that sometimes they won't have the words to use, or it's such a difficult situation that it's even just tough, even if they do have the words to deal with what they're going through, and that music gives them that other outlet.
The neat thing with the music program is that you can involve your family. Like, there was many times my mom, who comes every day for me, she was able to participate. So in a way, music brought us together.
I've seen patients more engaged. I've seen lots of tears, but tears of happiness and tears of emotion because of the trauma they've been going through.
One patient that really comes to mind, this patient suffered a severe stroke. So paralysis on one side of their body and speech impairment. And he beamed at the Beatles. He kind of was nodding yes to the Beatles, and she started singing Let It Be. And this patient immediately got emotional and started crying. And we started crying as the nurses at the nursing station, because we were seeing this first time in a while, a connection, a response, something more than just, how's your day?
Being in the hospital, it's hard. So if you can find areas of joy, it's really great.
Seeing how caregivers react around the music therapy is very important too. The unit feels better, there's a lighter sort of sense of things, and just everybody is uplifted.
How have we gone so long without music therapy?